Happiness Isn't Brain Surgery with Doc Snipes. This podcast was created to provide you the information and tools Doc Snipes gives her clients so that you too can start living happier. Our website, DocSnipes.com, has even more resources, videos, and handouts, and even interactive sessions with Doc Snipes to help you apply what you learn. Go to DocSnipes.com to learn more. Welcome back, everybody, to this series on crisis survival tips. In this video, we're going to be talking about toward thoughts and feelings. In the last video, we talked about toward behaviors, things that you can actually do to use your energy in a way that is going to help you stay safe, healthy, and happy. This video, we're going to focus specifically on thoughts and feelings. Toward thoughts and toward feelings are things that you think or feel that help you think or feel the way you want to feel. Mindful acceptance is one of the first steps in toward thoughts, and we've already done a video on mindful acceptance. Remember, that is noticing how you feel and accepting how you feel as it is, saying it is what it is, instead of fighting with it, saying I shouldn't feel angry, or I shouldn't feel anxious, or I shouldn't feel depressed, saying, okay, it's how I feel. You spend a whole lot of energy wrestling with negative feelings when you are trying to avoid them or tell yourself that you shouldn't feel a certain way. Mindful acceptance is just saying, all right, it is what it is. This is how I feel at this very moment. Now, it doesn't mean I have to continue to feel this way. This is how I feel right now. And once I know that, then I can identify what my options are and make a choice as to how I'm going to respond to these feelings. Another toward thought are strengths that you have. Focusing on times that you have dealt with similar situations and emerged victorious. Focusing on strengths that you have, mental strengths, emotional strengths, social strengths, whatever strengths and resources that you have that have helped you get through difficult times before. Remembering those, because if they've worked in the past, they're probably going to help you now. Identifying those things, start dusting off those tools and using them. A third toward thought are exceptions, looking for exceptions to things. Instead of saying everybody is going to get sick, identify the exceptions. Not everybody is getting sick. A lot of people are getting sick, but not everybody. When you start using words like always, never, everyone, nobody, then you are creating a situation where you are going to feel hopeless, helpless, and powerless. The key is finding exceptions. Who is staying safe? When we start hearing these numbers about the mortality rate of particular viruses or illnesses, it's important to look at who does that apply to. In the particular situation that we're experiencing right now, a lot of flu viruses and coronaviruses really target people who are older, over the age of 60, way more strongly than they target people who are younger. They also target people who have underlying physical conditions. You want to look at yourself and go, okay, so am I over 60? If I am, okay, I'm in a high risk group. If I'm not, how problematic is this particular situation? If you look at some of the data right now for some of these viruses and illnesses, you find that people who are under 50 and in relatively good health typically have a significantly lower mortality rate, 10, 20 times lower than those that are over the age of 60 or who have significant underlying health issues. This is important to know, because instead of going, if I get this, then, there's a X% chance that I'm going to die from it, that's going to cause you to feel really anxious. If you look at, where are you in that risk spectrum, and how likely is it that if you happen to get the illness, that you are going to have significant problems as a result. Other toward thoughts that you can do are just happy thoughts. I know it sounds silly, but if you focus on the things that are going well for you, focus on the things in your life that make you happy. At my house, we have a bird feeder, and spending a few minutes each day just watching the birds come to the bird feeder, listening to the birds, that makes me happy. Looking at the squirrels that are in the yard. I love squirrels. I love chipmunks. I love bunny rabbits. I like watching nature. Playing with our dogs. We have one dog right now who has some neurological issues, and she's kind of goofy and she's kind of silly because she has difficulty running, and she'll run and then she'll like, she can't stop. So she does this full barrel roll and then she gets up and starts running again. Doesn't bother her one bit, but she's really cute when she does it. Anything you can do right now that is going to help you feel happy is going to help cause your brain to dump some of those positive brain chemicals, the GABA and the serotonin, into your system, which will balance out some of those stress hormones. The side effect being you're going to be under less physiological stress and your immunity may be higher. And the final toward thought that we're going to focus on right now is serenity. In 12-step recovery, they have something called the Serenity Prayer that says, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And that's really what we've been talking about in this series of videos. There are things that are out of your control. You can't control what other people are doing. You can't control the virus itself, but you can control what you do. So knowing that, having serenity to accept the things that you cannot change, and knowing that getting upset over that is just going to burn up your energy and reduce your immune system. You don't want to do that. So serenity to accept the things you cannot change, the courage to change the things you can. That means do what you got to do in order to give yourself the best shot of staying happy and healthy during this time. And the wisdom to know the difference means stopping periodically and asking yourself, is using my energy on this effective? Is this something that I actually can even control? Those are my tips for some toward thoughts during a crisis situation that can help you maintain your health, maintain your immunity, and hopefully regain some happiness. The ability to launch DocSnipes.com and the Happiness Podcast is in large part due to the sponsorship from our sister site, allceus.com, providing continuing education and pre-certification training to addiction and mental health counselors around the globe since 2006. If you are a mental health counselor or addictions counselor needing CEUs, or if you want to become an addictions counselor, peer specialist, recovery residence administrator, or certified recovery coach, please visit allceus.com. Unlimited CEUs starting at $59 and specialty certificate tracks starting at $89. Go to allceus.com to learn more.